Dr. Lucy McBride. Welcome to the show. How you doing?
I'm great. Max, thanks for having me.
So good to have you all the way from DC, which is a city I love when the weather's nice. So thanks for coming out. Thanks for helping us unpack how to take charge of your health today, which I think is such an important conversation. And I think maybe you'll agree with me, maybe you don't, but at least from my non-medical doctor vantage point, the tools today, we have unprecedented access to tools, which make this, I think there are fewer excuses than ever to not take control of your health. So thanks for putting this together.
So glad to be here. I can't wait to tell you about this book. It's really for anybody who's disillusioned with the medical system, where you have maybe 15 minutes at max with your doctor, and through no fault of your doctor, you're kind of hurried through the visit. You're treated like a bag of organs, a set of symptoms, and the visit feels transactional. They don't have time to ask you how you are in your real life, like what's going on. Medicine excels at fighting diseases, but is pretty terrible at helping people live their lives. So then, no surprise, people go to the wellness industry for medical advice. They want to be well, and I want patients to be well. But where the medical system is often prescriptive, so can the wellness industry with protocols and plunges and prescriptive advice that isn't necessarily wrong. It's just it doesn't necessarily tailor to your needs. There's a lot of solutioning, a lot of prescription being given out without asking the right questions first. So this book is designed to help people ask better questions of themselves and then of the people responsible for their care, whether it's your doctor or a wellness influencer.
Yeah, it makes a lot of sense. I think it's I think it's important for people to remember. Context is pretty important. I think most of the time.
Yes.
All of the time.
All of the time.
And the wellness industry wasn't created in a vacuum. It was created. It is what it is as a response
100%.
to the way that many people feel that they've been treated in the industrial healthcare complex.
100%. It's a direct reaction to the unmet needs people have, given that 100 million Americans, probably more at this point, don't have access to a primary care doctor. So if you don't have a doctor, or if you do, you have 5 minutes with that person, and you have a complaint today, but they can't see you for 3 months, what are you going to do in 2026? You go online. You look for answers. I do that too. I go online. I'm what the hell's going on here? And I figure it out, right? There's a lot of solutions. The problem isn't, nutritional advice and fitness advice and, advice to be mindful and prioritize sleep. That is good. It's that we haven't adequately armed people with the right questions to ask either ChatGPT or their doctor. So they're coming in to my office or putting into the search bar, what do I do about my fatigue? Or what do I do about my sleeplessness? That question is a good question. But buried beneath that question is a stack of questions that they should be asking themselves or that their doctor should be asking them. Where are you hormonally? What's going on with your relationship with alcohol, not just how much do you drink? What's going on at work? Because some people have fatigue because they have a, medical problem like hypercortisolemia or something but most people have fatigue because they've got habits that could be adjusted. They've got stress that hasn't been sort of named or managed. Because their doctor has not said anything about their alcohol use because they technically aren't alcoholic, but yet the alcohol is impairing their quality of sleep. All of that nuance gets missed when you have 5 minutes with a doctor or you're putting a search into ChatGPT.
It's so true. So what are the right questions to ask then? Does it ultimately come back to a form of science literacy that you think we're
I think it's much
neglecting?
more basic than that. I think it's much more basic. We can map the human genome at this point. We can 3D print a new heart for somebody with heart failure, right? But we are failing to arm people with the questions they need to ask themselves. For example, doctors are great at asking people, how much do you drink, right? Patients will answer the question literally, and sometimes they, minimize it, right? The question I want to ask patients isn't how much do you drink, it's what is your relationship with alcohol and how does it serve you or not serve you? In other words, what is the reason you drink? I mean, maybe it's because you like it and it pairs well with food, but maybe it's because you're in a marriage or a relationship that is toxic and you're trying to just zone out at the end of the day, or you're raising children and you're working and you just need to, cut the noise. That noise, interior noise, anxiety or just stress needs to be addressed more than the alcohol does. But a doctor might say, oh, 2 glasses a week, 5 glasses a week, that's fine. That's in the parameters of what we recommend. But the question isn't about quantity, it's about the relationship. Okay, so to answer your question, Max, this book basically is not a here's what to do book. It's a here's how to think book and here's how to get what you need and ask for it book.
I love that.
So you kind of have to read the book to understand all the questions you're supposed to be asking yourself. First, we're going to ask yourself the big question. What does health look like to me? What is health? I used to think when I was younger, like pre-med school, even in med school, that health was about a certain fitness level, a body size, like eating broccoli. That's what health was. You get older, you get a little more tread on the tires, you have some experiences with grief and loss, and I know you've experienced loss in your life, as have I with my brother 2 years ago. And even before that, but certainly after my brother died, you really reconceptualize what health means, right? It's not about 10,000 steps a day or making sure you have quinoa, or it's really about meaning and purpose in your life. It's about connection with other people. It's about understanding your interior landscape, how you manage stress, how you manage and handle relationships, how you tolerate emotional distress. It's also about how you advocate for yourself, like how you make your needs known, whether it's in a relationship or with your doctor. Because as a physician, like I can easily tell people, take Lipitor for high cholesterol, take Prozac when you're down. But just because there's a pill for this symptom you have doesn't mean that I'm solving the problem you have. Like, let's not assume that your tolerance for risk as a patient is the same as mine, or your tolerance for distress is the same as mine. In other words, the first question you want to ask yourself is, why am I alive? Like, what is this? Why am I even going to the doctor in the first place? Why do I need these labs? Like, is it a performance? Is it to get a gold star? Is it to win your appointment? Or is it because you want to live X, Y, Z? Like, tell me. Like, I need to know, like, why you're here and what you want, right? Now, it's pretty obvious. When someone has a sore throat and they come in, I don't need to talk about, like, why they're alive. I just need to know they're sick. They need a strep test. But I'm talking about, 6 in 10 Americans are walking around with chronic illness. 4 in 10 Americans have obesity. Yet our life expectancy in the U.S. is lower than all, rich countries. So we're failing as a medical field to ask people how they want to live and how they want to prevent disease. And that includes taking stock of what your goals are first, right? You wouldn't operationalize a plan as a consultant around someone else's idea of what they want, right? You ask the client. So that's the first step. Second step, when you're trying to ask better questions, is to map your health ecosystem. What do I mean by that? Sounds fancy, but it's really simple. We think of health as a set of cholesterol labs, a C-reactive protein inflammation marker, your CBC, your blood counts, and that data matters. But so does your relationship with food, your relationship with alcohol, your relationship with your mother, your relationship with mortality. So does not just your exercise routine, but like what hurts, what injuries do you have, what are your vulnerabilities, even when you're not in pain and you're able to exercise and move. Like, let's take inventory of your skeletal health. And then in terms of nutrition, it's not just what you eat, it's what's your relationship with food. Like, are you self-medicating by restrictive eating or binge eating, or our relationship with food is sometimes the most complicated relationship we have. So
Why do you think that is?
because you have to eat to be alive, and it's something you can control and manipulate, and it's something that is inherently tied to emotion. We eat for two reasons: survival and emotion. And that's not wrong. That's just the way it is. There are very few people who just eat for survival. Right? That's a robot.
Right.
So most people eat because for celebration, for joy, for pleasure, right? Because someone brought in cookies for Marcia's birthday, at work. We also eat to numb uncomfortable feelings. We eat to zone out and give ourselves a reward. And for people, for example, who've suffered with obesity and weight problems, that is filled with shame and self-loathing and feelings of unworthiness that then can perpetuate a cycle of overeating. There's also the restrictive eating disorder. I mean, if you ask enough people about their relationship with food, like, there's a whole story that goes along with it. So I guess what I'm saying, Max, is not that that your health ecosystem is not just about your medical data, like your biometric data, your blood pressure, your cholesterol, all of that matters. It's also about your biographic data. Like, who are you? What's going on in your life? How did you form this relationship with food? Like, where did the connection between like sort of worthiness and thinness get born? Like, where did that come from? Because when you start to unpack those layers with patients and when they start to ask themselves the right questions, that's when we can really unlock a health ecosystem that's stuck. It's not about pills. It's about self-awareness and then advocating for yourself and finding the guides who can help you get where you want to go, not where I want you to go.
Amen. Yeah, I think we've all seen that meme circulating online of the patient who just looks sickly sitting on the, on the bench, the bed or whatever in the doctor's in the clinic, and the doctor's like looking over his checklist and it's like, your labs look fine.
Right.
Turns out you're healthy, and like the patient is depicted as being like clearly unwell.
Right.
Despite all the labs ticking all the boxes.
Yeah, labs are one piece of the puzzle. You can't measure in a blood test someone's emotional distress, someone's relationship trauma, someone's lack of boundaries at work where they're being sort of harassed or abused. Then they go into the break room and maybe drink some booze or maybe down some coffee or, just feel awful, right? You can't measure so much of health in a blood test. So again, it comes down to asking questions of yourself and of the people who are responsible for your care about how to, help you with the things that are unmeasurable, that are immeasurable. So take menopause, for example. So perimenopause is a classic example of something that you can't measure in blood work. You can draw blood and check hormone levels, sure, but it turns out that's not actually helpful. We treat the patient, not the labs, when it comes to hormonal fluctuations in menopause. Ask any woman who's been through perimenopause or menopause if the feelings they had of hot flashes, night sweats, low libido, like brain fog, were real. In fact, if you accuse them of them not being real, you are likely to be assaulted. In other words, but those are not measurable in blood work. Those are not measurable in a lab draw. They're not measurable on CT scan. So to answer the question about what should I do about my menopause from a patient requires me to ask questions. What's going on? And when you learn that they have hot flashes and night sweats and brain fog, and then you empower them with nuanced information, up-to-date information about the safety profile of hormone replacement therapy, and then put them on that prescription and they feel better, it's proof, again, that not everything is measured in blood. Quality of life you cannot measure in a lab test.
Yeah, and unfortunately, we still, as we record this in 2026, we have AI, we've just landed on the moon for the second time, we're heading to Mars. We still don't know everything about the human body. I mean, I had a medical scare a couple of years ago, and it dawned on me then how, some diagnoses are, you just have to exclude all the most life-threatening things.
Right.
And, oftentimes there are many conditions that can be idiopathic. Like there's no clear explanation. I developed Horner syndrome randomly.
Interesting.
Yeah.
You notice your pupil was
Yeah, and my
funky?
eyelid was like,
Yep.
on some videos on social media, I get called out for it because people are like, are you using like a filter or something? I'm like, no, I had like a couple years ago, it was totally random. I had gotten off a flight in Austin, Texas, and I was like at a restaurant with some friends, and I felt completely normal. I went to the bathroom and I looked in the mirror and my right eyelid was at like half mast.
Yep.
And I called a friend of mine who's a neurologist, and he was like, you have to get to the emergency room. That's usually a sign of like something really bad happening.
Well, it can be a stroke. It can be something really serious. But Horner's is a neurological condition. And we often don't figure out why.
It's rare, apparently.
It's rare. It happens.
Yeah.
And that's a good example of something that isn't necessarily emotionally informed. I'm not trying to suggest that everything in your lab work or like your breast cancer is because of your childhood trauma or your relationship with your mother. I'm just saying that there are things we do not know, that we don't ask about in medicine, and context always matters.
Context always matters. Yeah. They had to basically rule out the stroke, the carotid dissection, the mass in the lungs.
Look at you, have a whole vocabulary.
I have yeah. I'm pretty well versed. I mean, my it was scary. I thought I was going to die. I thought it was like, I thought I was counting my last days, and the best like answer that we got is that I occasionally get migraines. So it's like it can be in some associated with migraines, and I do get migraines.
It can be. It's like a neurovascular event, which a migraine is.
Yeah.
And so Horner's can be associated. That's right.
It's wild. So yeah, how do we shift people towards a mindset of empowerment versus anxiety? Because a lot of people do tend to feel anxious about their health. There's a phenomena that's sometimes referred to as the worried well, especially today on social media. People get obsessed, as you referenced, with these protocols, these intricately complex morning routines and the like. So how do we then? What is the mindset shift you think that is going to move the needle for people?
The short answer to that, Max, is it's moving the locus of control from out there to in here. So you can ask your doctor for advice. You can go online and ask for advice, and you'll get lots of answers, right? Protocols, prescriptive advice. And again, some of that is not wrong. But what you're doing by asking other people what you need to be healthy, and I'm talking about preventatively, you're outsourcing your intuition. You're basically putting the locus of control out there to other people. I'm not saying be your own doctor or be your own yoga instructor or be your own, supplement advisor. I am saying to first ask your questions to yourself, to move the locus of control inside, to ask yourself, with the help of my book and the taxonomy of questions I give you, what is the actual problem I'm trying to solve? It stuns me that my patients, super educated, super well-informed, super motivated, and my Substack readers ask me questions all the time that belie a question beneath it. Like 3 or 4 questions down is the actual question, right? So
the question beneath the question.
The question beneath the question. So, they'll ask me, they sometimes come with the answer, right? And people do this all the time, right? This is in ChatGPT, like, do I need a GLP-1 medication? Or should I take hormone replacement therapy? What that implies is you've already answered the question and you're asking for permission, right? From either AI or your doctor. Better question to ask yourself, and this is just a reframe. Think to yourself, when you're asking, do I need a GLP-1, what are you actually asking? Because you're not asking, if you're asking for permission, that's one thing, but you can ask your mother for permission to do things or something, right? What is the actual problem you're trying to solve? Because one person who's asking me, should I take a GLP-1, is really asking me, do I need to lose weight for my health? Another person is asking me, do you think a GLP-1 would help me regulate my alcohol use because I read that it can curb cravings for alcohol? So those are the questions I want you to sit with and to reckon with. And that requires turning the locus of control or like moving the locus of control from out there to in here. Like really get radically honest with yourself. What are you actually asking? Like what's your pain point? And by the way, if your pain point is extra weight that you're carrying that isn't causing, high cholesterol or diabetes and your weight is actually normal, no harm for asking the question, should you be on GLP-1 just to lose weight cosmetically? But be honest with yourself about what that question is, right? So I have lots of patients who want to be on a GLP-1, like a Zepbound or a Mounjaro, just to lose like 10 pounds or 5 pounds to like fit into their clothes. Fine, no judgment, but be honest with yourself about what you're asking. Because if you're asking, should I take a GLP-1 to ChatGPT or to me, what you're really asking is, what do you think, Dr. McBride, ChatGPT, about cosmetic weight loss, even though I don't have the medical reasons to be on it? And I would turn it on the patient. I say, well, what do you think? Like, what is the relationship you have with your own body? Like, what are you looking for? What is the pain point? Like, what is the thing? It's a long way of saying, Max, be radically honest with yourself when you're typing into ChatGPT or preparing to go to your doctor's office. Like, what is it? What is the pain point? What is the problem? Is it emotional? Is it social? Is it medical? Is it psychological? Or is it like you just don't know what the question is? But if you don't know what the question is, I would go and like get a journal or voice memo or something and really try to get at the essence of what you're asking, because your doctor has 5 minutes and ChatGPT will give you a solution. But if you're not asking the right question, you're getting answers to things you may not even be asking.
Is that something that you commonly see, is people coming into you asking to be put on a GLP-1 drug for vanity reasons?
Oh, all the time. Yeah. I mean, yes. And I don't blame them, right? I mean, these are wonderful medications to help people lose, just stubborn weight loss from menopause or weight loss they can't lose because they live a high stress lifestyle. And they're extraordinarily effective at helping people with true metabolic dysfunction. My patients with type 2 diabetes and sleep apnea and cardiovascular disease, they're extraordinary. In fact, they are arguably the most interesting part of the GLP-1s is their ability to help people feel empowered over their body and their mind, sometimes for the first time in decades. But what you don't want to do is enable someone's body dysmorphia or restrictive eating disorder by giving them a substance that causes them to like starve, right?
Yeah, I mean, it's forced anorexia pretty much.
Right. So as I said to a patient last week, like the goal isn't, she was reporting to me as we had increased her dose for her diabetes, that she was still a little hungry on this medication. And shouldn't we increase the dose? And I'm like, no.
You need to eat,
My goal
sis.
is not to castrate you from normal body cues. Body cues, hunger, satiety, feeling calm. Like those are normal body cues. You need to listen to those. So no. Having hunger is good. In fact, you have to eat to lose weight.
Well, you have to eat protein to lose the kind of weight, to lose high quality weight.
That's right.
Fat mass as opposed to lean mass.
Right.
Which includes muscle, but also bone.
Exactly.
And yeah, no, super
So
important.
the problem I have is with the concern I have. It's not a moral problem. The concern I have is for patients who are centering a number on the scale over like health meaning metabolic health, cardiovascular health, bone health, muscle health. So sure, I can help you lose weight on a GLP-1, but if you're not maintaining your muscle mass and your strength and you're not getting adequate protein, like that's not a good outcome. I mean, that may be the outcome they want, but my goal is, again, to reframe the question. Like, I'm here for your health, not for like a specific like cosmetic outcome. That's you see plastic surgeons and people prescribing these meds all the time, and it's obvious by the prescriber what their goal is. That's not my goal for patients.
Yeah, we've almost it's kind of like a perfect storm where there's now the ubiquity of these drugs, which I'm all for, like in the right set and setting.
That's it.
Like that. I mean, crucially important. I'm not anti them. I think they're revolutionary in many ways, but also, it's their prominence has come at a time when also, everybody is glued to their social media, accounts and whatever, and seeing everybody else's highlight reels, and people are just flaunting these completely unrealistic body expectations, and yeah, these drugs are now, I mean, it's almost at a point where they've become the path of least resistance for people.
It's an epidemic. So on the one hand, I think they're extraordinary and arguably the most sophisticated medical technology in my lifetime. They're also not a panacea and can do serious harm. I mean, if you look at the images of these celebrities on the red carpet, right?
Oh my God!
And
Yeah.
I believe that the ease with which we criticize people's bodies and women's bodies in particular and police bodies is like horrible.
Amen. Yeah.
Like no role for that. At the same time, you can't help notice what message is being sent accidentally or on purpose to, young people online looking at these sort of emaciated figures. And I just feel sad for women who are ingesting that sort of messaging and thinking to themselves that that's the standard. I mean, this is not a new problem, Max. I mean, women's bodies have been policed since the beginning of time, but the GLP-1 era is ushering in sort of, thinness culture in its like extreme form.
It's crazy.
It is.
I was at a party this past weekend, and a guy who I had just met told me that he had just had a kid, and as a result, he had put on like 30, 40 pounds of fat. And he's somebody who had already had in place, like at some point in his life, he had been thin, and he was aware of like the value of dietary protein and his strength training and all that stuff. And he said that just to get that weight off quickly, he went on like a low dose of one of these drugs. He wasn't like obese, but he had clearly accumulated. He showed me like a before photo. He had clearly accumulated a lot of like, excess visceral fat. And he went on one of these drugs, and he took the drug so long as, for whatever duration it was required to lose that 30, 40 pounds that he had put on, post having a kid. And because he had been aware and had those healthy habits, in place at one point in his life, he said he just came off the drug and the weight didn't come back, which I know that it tends to come back for many people when they come off the drug if they're not learning how to
that's it,
properly eat, right?
Yeah, but there's a lot of hyperbole in the headlines, and I am seeing patients successfully weaning them off themselves off these medications, or with my help. And the people who are most likely to successfully wean off these medicines are the people who use the window of time while they were on these meds to grow their insight about their own relationship with food and then adjust habits accordingly. It's that window of time that I find so interesting for many, many of my patients, particularly the ones whose relationship with food was disordered and they didn't know it. Until the food noise was quieter, they didn't realize, oh my gosh, I was like riding a bucking bronco of like shame and deprivation and overeating, and then they didn't know. And back to what we were talking about earlier, that is the question that I wish patients could ask themselves before they had to get on the GLP-1, or, with regard to any sort of like behavior that's every day, whether it's sleeping or eating or exercising or relating to other people, like querying that space between the unconscious mind and the conscious mind, right? I mean, that's where the action is. That's where the locus of control should live if you give yourself a minute to be curious about it.
How do you propose medical doctors implore that in their patients? I mean, it kind of sounds like what you're asking, primary care physicians to become. It is in a way like therapists.
Yeah. I'm not a therapist, but so much of our health is psychological and social emotional. And if I didn't have a curiosity about people's interiority, first of all, my job would be super boring. Second of all, I would not be empowering people. I would just be a prescription pad and dispensing, sort of protocolized advice.
But there is something very comforting about you. Like I get like a maternal. We just met, but I get like a maternal vibe.
Well, I'm a mom.
You seem like a very compassionate person. Like
I think so.
Many doctors are not that way. Like, there's the whole concept of like bedside manner. Like I've encountered many physicians over my lifetime, people who I've had on the podcast even, and I'm like, man, you seem like a really smart person. Like you've got all the academic
But I never wanted
accolades, but I would never want to be sitting across from you in a time of like health need.
Well, so here's the thing. I realized early in my career, like I trained at Harvard Medical School and Hopkins, and I got the most incredible education ever. But I realized pretty early on that what I thought I was going into as a field wasn't really designed to help with the rapport and the relationship between patients and doctors. Through no fault of physicians, it's our system. Like doctors are incentivized to sort of move people through, or incentivized for volume, not quality and empowerment of the patient with information and nuanced guidance. And like, to me, health isn't about seeing me. Health is about the 364 days a year you're not in my office, like living your life, making decisions. Like, should I do this? Should I do that? Like, should I drink a beer? Should I, get on this motorcycle? Should I, take Lipitor? Like, those are things that I can help you decide, but I want to give you the frame. So to answer your question, yeah, I think I'm a pretty compassionate person, not every day. I'm maternal. I have 3 children and I have a mother. I think what my biggest fear is that people are just being treated like a bag of organs and a bag of body parts. And I think, you don't want to get me started, Max, on like what healthcare should look like in this country. But it could look like this. If we were to scale a model of primary care where doctors and patients had time, I believe that most physicians that go into the field of primary care go into it for the patient-doctor relationship, not for the kicks of it, not for the, giggles and conversations and to be a therapist, but rather to elicit the information that we need to help the patients. To grow trust, right? Trust is the glue of any patient-doctor relationship. If you have 5 minutes, it's hard to build trust. I believe that everyone who went into primary care medicine as a field went into it for that. They want to talk to patients. They realize that sometimes the prescription is just the moment the patient realizes you're paying attention to their grief, to their pain, whether you fix it or not, but just the act of listening and accompanying someone through their process of being alive. And I believe there's a world in which we scale a model of primary care where doctors are just given that time, where they're rewarded for the time with patients instead of volume of people they see in a day. In fact, if you look at medical economics, if you look at the data on like how it would look to help people live longer and live better in this country, it's not a mystery. The healthcare system is broken by design. What we need to do is scale primary care. When you dispense primary care into communities where patients have access to a medical home, where they are known by their name, not just their diagnosis codes, and they get problems solved in-house, and where primary care is not just a referral mill, you save money and you save lives. So like that is possible. We have the tools. The problem is graduates of medical schools are not going into primary care fields. Why would they? They go into fields where there's treating 2 square inches of the body because that's where you can make money. And where you're not going to be morally injured by having 5 minutes to care for Mr. Jones, who's 80, just lost his wife, is on 10 medicines, and you got a waiting room full of patients. People are not graduating and going into primary care fields. So we're looking at a huge shortage as the patient population is aging, and doctors are burnt out. The system, we could reinvent it. The tools are there, and AI would be part of it. AI would help not replace the patient-doctor relationship, which a lot of tech guys want to do, and gals, but rather to do the grunt work of primary care, the back office stuff, the prior authorizations, the haggling with insurance companies, so that we could elevate the relationship and not eliminate it.
I love it. Do you think there's a world in which, because oftentimes you'll hear advocates of academic evidence-based medicine create this dichotomy between institutional medicine and the wellness industry.
Right.
We've had conversations, in that sort of domain recently on the podcast. Do you think there's a world where wellness and medicine can coexist?
Yes. In fact, that's what my book is about. I think there's a lot of hubris in the medical establishment about being anti-wellness, like the wellness industry.
I agree.
Doctors aren't anti-wellness. Like, obviously we want to be well. We want to help patients be well. But I think we need to recognize the limitations of the system and the limitations of our medical education to help medical students, residents understand, what we've been talking about, which is that health can't always be measured in a blood test or a CT scan, that it's about eliciting questions from patients, solving the right problem, and asking before we answer. That's a question of time, trust, and rapport with a physician who knows you. That is cheap. Inexpensive, meaning. So I think the medical establishment is very quick to poo-poo, dismiss, and, malign the wellness industry. When the wellness industry has done a lot of good, right? Like, people understand protein as part of their, nutrition routines. They understand that exercise is good for them, right? They understand that mindfulness and sleep hygiene and, sunlight are good for you. That is good, because doctors don't have time to talk about that stuff. The problem, as we've been discussing, is that, yoga and quinoa are maybe necessary for being healthy, but they're not sufficient. So you can exercise all day long, cold water plunge, count your steps and your macros, and still get pancreatic cancer, right?
Amen.
And you can be, by the way, super unhealthy, and live a long life. So, like,
You just have genetics in your favor.
correct. So there is a world where primary care is able to address the person, not just your lab tests, and talk about how much time are you spending connecting with other people? How much time are you spending online as a way of numbing out or isolating or, managing your social anxiety? Those questions need to be elicited, because that's when I can hand you the keys to your own castle and not act like I can just solve it with a prescription for Zoloft or, I love Zoloft. I'm just saying that it's only one tool in the toolkit. So I think that, and then I think the wellness industry needs to realize that, data does matter, right? Like, just because you have a lived experience of fitness as a way to have, gotten yourself healthy doesn't mean that everybody, if they get fit, is going to be healthy, right? Like, fitness is good, but we also need to understand that health is more than just an exercise routine or a nutritional, protocol. That we also want to be careful about dispensing advice with the certainty that is often behind a lot of the messaging in the wellness industry without the data to support it.
Well, that's true. Sometimes, often the fittest people you'll see on social media have horrible relationships with food, with their bodies. They're running on industrial levels of caffeine just to get by.
Right. And I think, medicine is in science are iterative, and, sort of the definition is we're never like certain about anything, right? Like, the lack of certainty is sort of a feature, not a bug. And so what gives me pause is when I see influencers out there professing certainty about this is going to help you, this is going to do this is going to, the illusion of control is very sexy to somebody who's been dismissed by their doctor.
Yeah. I feel like even the word protocol is a bit of a psyop, because it suggests that there's rigor underlying the recommendation.
Right.
When oftentimes the recommendation was pulled out of whatever influencer's proverbial butt.
Right. And it's for profit. I mean, it's like,
there are incentives across the board.
There are incentives on both sides. I mean, let's be honest. But, like, take peptides, for example, right? The proliferation of peptides is just one example of, like, just because we can doesn't mean we should, right?
Yeah.
Like, I think the peptides, the ones that are like the Wolverine stack and these peptides that patients, microdose and give themselves and are being purchased in sort of not in medical settings, are enjoying the limelight that the peptide GLP-1 has received. So I think I think the wellness industry has kind of capitalized on the enthusiasm for GLP-1s, which are an FDA-approved, well-studied peptide with human, subjects in the clinical trials. And then they're applying that logic to these peptides that are not studied in human necessarily, that have like teeny animal studies, and then sort of weaponizing biology and the word peptides to sell people the illusion of control. And some of these peptides may actually end up being like amazing and help people with muscle recovery and injury repair, but just because something's biologically plausible, or because an influencer says like this helped me with my like tendonitis, doesn't mean you need to do that. Again, it goes back to like, okay, if you have an injury problem, a muscle repair problem, like what's the question you're trying to, what is the question? Like, if you're looking for a quick fix, like you're probably barking up the wrong tree, right? Like sometimes the injury isn't getting better. It's because you haven't strengthened the adjacent muscles around it. There's no like peptide for it.
It's so true. No, it feels to me, it's worrying. It feels very much like the wild, wild west. And I'm all about medical autonomy. And I think people, I personally enjoy, I've taken some peptides, in question. And, but I think it's the hype surrounding them has far outpaced the data at this point. And it's a little scary to me. I'm like, are we going to have just like a ton of crazy lawsuits in 10 years from now?
Well, think about, there's so many peptides or substances that we've, that have seemed biologically plausible, that were run through the FDA regulatory channels, that were FDA approved, that turned out to be harmful, like Vioxx or Fen-Phan. So be careful what you believe, right? There's a religion around sort of some of these substances that are kind of have the shroud of kind of biology around them. But just because someone says this is right for you doesn't mean it's right for you.
Yeah.
And I understand why people are lured into that thinking. They've been prescribed Lipitor, for example, by their doctor, and it gave them muscle aches. And the doctor might have just said, hey, why don't you just work on your diet and exercise, and let's recheck your cholesterol in 3 months. And it might have gotten better without the medicine. So people are looking for someone to trust. They're looking for a guru. They're looking for guidance when the medical system has not met the moment. Yeah,
and you say that patients should become the CEOs of their own health.
Yeah, and to be clear, that's not DIY medicine. It's not doctorless medicine. It's realize how much data you have on yourself, your story, your social emotional health, your whole interiority needs to be downloaded into this map that I walk you through in my book, to then better frame the problems you have and the questions you have, to be able to get the answers you need, not the answers that your doctor thinks you need.
Amen. What do you make about longevity gurus pathologizing aging itself?
Well, that is just bananas, right? Aging is, as you know from losing your mom young, aging is a gift. Aging is normal. Like anti-aging is an oxymoron, right? Anti-aging is an oxymoron because we are aging. So it's a brilliant business model, because if the goalpost is always moving, voila, it's very profitable. Do I myself want to age less fast? And do I put lotions and potions on my face and do this in the mirror every now and then? Absolutely. But I also know that it's not about my worthiness, or that there's some, behind the curtain, there's some special sauce that my doctor is keeping from me, and that if I just bought this, I would actually age backwards. So I think, to answer your question, the anti-aging industry is a brilliant business model because it's not possible, and there's always more stuff to sell people.
Yeah, the fountain of youth has been sold by snake oil salesmen since time immemorial. It's something that humans have always desired. But now we get to wrap it in the language of science. And so it sounds a little bit more legit, even though it's really fundamentally kind of the same thing.
Yeah, it's a religion, basically. And that's fine. Choose your God, choose your religion, choose your guru. That's fine. Who am I to tell you what to believe? But I think what you're actually talking about, Max, is the fact that trust in medical institutions and in doctors is at an all-time low. even before the pandemic, we were seeing that, in the old days, I sound like an old person now, but even before I became a doctor, the town doctor was like the revered sort of person in the community who like you'd go to for your toe fungus and your diabetes and your grief, right? In the modern era, and I think this is largely in part of our medical system being so fragile and so broken, and because of politics and all the things that we're dealing with in the modern world, I think people are really dazed and confused and not sure who to trust. And then the pandemic really shook people's trust in medical expertise and the establishment. I mean, it just did. And so you've got the internet ablaze with solutions and optimization protocols and wellness advice. You've got doctors exhausted and burnt out and frustrated and no time to talk to patients. And then you've got humans who are like just trying to live their lives and make decisions. So it's no wonder they go to this place, this oasis of online information and the illusion of control and certainty. And yeah, I want to age backwards. That sounds good.
No, I mean, I'll tell you though that like having recorded hundreds of episodes of this podcast, I've had people on the show who are highly credentialed medical doctors from like cathedrals to academic medicine is where they've come through, like those channels, and they'll be sitting across from me and they start talking about, for example, nutrition, something that we know that medical doctors don't get a whole lot of training with regards to. But they start speaking confidently because they've got the MD after their names.
Right.
And I'm sitting across them and I'm like, you really, you don't know what you're talking about. And I do my best to push back, but that's not like the format of the show. It's not like my place to, turn a conversation, like a good faith conversation, into a debate. That's not what I'm interested in. But it is wild that for all the flack that the wellness industry gets and there is a lot of that is deserved, to be clear. But a lot of, you'll see many physicians, medical doctors come on and like also spout stuff that they don't really know what they're talking about. But they do it with crystalline confidence.
I mean, Max,
like unshakable confidence.
Make humility great again in medicine.
Amen.
Right? Humility is actually at the core of what we do as doctors. Like, I'm the first to say, like, I'm not always humble. Like, ask my kids. Like, I'm like, do this because I said so, right? So, and like, they're like, well, how do you know that's, I just know, right? So, but when it comes to patients, if I've learned nothing else in 25 years of sitting across from patients, they know them better than I will ever know them. And I don't know everything. Like, I did a lot of studying. I sacrificed my 20s, like, whereas my husband was off, like, having a fun time in college. I was, like, locked down to the library, like, sacrificed my entire 20s to be a doctor and whatever. I mean, it was worth it. But one of the things you learn in medical school and in residency is how to learn. Even if I didn't learn a damn thing about nutrition or menopause in medical school, I did learn how to learn about it, and I learned how to critically appraise information and critically appraise data. So, and still, there's no way to know everything, and we need to be humble about the limitations of medical training and medical expertise. I think what you're witnessing, I'm guessing, when you're talking to doctors who seem to have a level of confidence about their knowledge that outstrips what's actually going on, is people are threatened. Doctors are threatened by the wellness industry. They're threatened. Or they're just annoyed that, patients come in. I mean, this happens all the time in my office. Patients will come in, I mean, more in the last 5 or 10 years, like much more. They've got the printout from ChatGPT. They've got an article, and they've got a recommendation that they just want me to approve. Like they've got their own, they've already solutioned the problem, and they just want me to like green light it. Fine. Like, I like an empowered patient. I like an educated, informed patient. But because there's so much misinformation out there, and there's so much lived experience as a proxy for expertise out there, doctors are just annoyed. They're annoyed. I mean, I get annoyed too. I'm like, oh, dude. I mean, I can talk to my patients honestly because I know them. I'm like, that is just BS. That is just BS. But again, like, you do you. Like, I'm here to just be the guide. I'm like the raincoat of watches. Like here are the options, and then you choose. But let me tell you that there's risk on both sides of every decision, right? Everything we decide to do, whether it's follow that guru's advice or take my advice, there's risk involved. Let's be honest about that.
Is there a specific story that you can share with us about a patient interaction, perhaps, that has shifted your thinking?
About
patient empowerment, about where, empowerment can sometimes drift into anxiety.
Okay, so
and become
perfect example.
counterproductive.
I mean, this happens all the time. So it's like, but I can think of one patient in particular. So as you may or may not know, hormone replacement therapy has gotten a bad rap for a long time.
Yes.
Like menopause hormone therapy, estrogen and progesterone, the two hormones that are made by the female ovary. They've been given a bad rap. Like they need a new PR person, right? We were told, and I was part of the problem. The medical establishment gatekept and basically messaged to generations of women that HRT, hormone replacement therapy, is harmful. I can go into why. Basically, a short story, it was the Women's Health Initiative study, halted early in 2002 because of a signal suggesting that it caused breast cancer. Okay, the study was a great study. The study was not flawed. The interpretation was. So we're now in the place where we've realized, even with the WHI studies, but certainly studies since then, that hormone replacement therapy is the standard of care for all women in perimenopause and menopause, unless there's a reason not to be on HRT. Like you start with HRT. But that message is not getting through to people. And as a result, you have a whole industry trying to help women cope with the symptoms of menopause by giving them supplements for this problem, vitamins for this problem, the guruification of menopausal symptoms and the fear-based messaging that some of the wellness industry has taken up about hormones.
Yes.
So that's just one sort of slice of the wellness industry saying like, hormones cause me to get breast cancer, cause my mom to get breast cancer. Doctors don't know what they're talking about. And they're sort of leveraging that fear and then to sell their own stuff. So I had a patient, super educated, super smart, was taking a whole bunch of supplements for her menopausal symptoms, convinced, even though I was trying to help her understand the actual data, that HRT caused her mom's breast cancer, caused her grandmother's breast cancer, and she wasn't going to take it. That's fine. Like, who am I to say what your tolerance for risk is? My job is simply to arm you with the data. Okay, these supplements weren't helping her. In fact, she developed a liver problem because of one of the supplements. And they weren't also helping her with the symptoms. I finally got her to agree to try hormone therapy. In 3 weeks, symptoms were gone.
Wow.
Brain fog gone, elevator going to the top, not hot flashing, not night sweats. Suddenly her libido was a little bit back. She was like rekindling her relationship with her spouse. And it's not that I sat there and been like, I told you so. It's that patients are very distrustful of doctors because of mistakes we made, and they have a right to be distrustful. The wellness industry is weaponizing that distrust in some cases, and then selling people a bunch of stuff that isn't evidence-based, and then depriving them of the thing they actually need. And this is like a Tuesday in my office. Do you know what I mean?
Yeah.
It's dismantling the mythology that's out there and helping people get what they actually need. But it is hard, right? If trust, again, in your relationships with, romantic partners, friends, like think about what it takes for you to trust that person, right? It's humility. It's being able to adjust your recommendations or your advice based on changing conditions or changing data. It's about listening. It's about understanding the person, right? You don't trust a friend who's just like telling you like, here's what you do, or, well, and you're like, but dude, like I already broke up with her. I don't, and he's like, well, you still need to, like, so when it comes to patient doctor, I got to listen. I got to understand. I got to understand where the patient's bias came from, not dismiss her for going into the wellness jungle, not shame her for being, preyed upon, because that happens to me too. But to understand where she is and meet her in that moment, that takes time.
You know, what's very frustrating to me is I've seen it firsthand. What you're describing, how the wellness industry can exploit the confusion and the
Yes.
frustration.
Yes.
And I see this often just with regards to like basic like diet, like nutrition and fitness. Like there's this myth. It's a myth perpetuated by various like influencers that, you know, certain populations of people need a different like approach towards diet and lifestyle, like that, you know, for example, perimenopausal or menopausal women, you know, need to work out a certain way.
Oh my gosh, that packaging is bananas.
It's bananas. Need to work out a certain way,
The
or eat a
menopause
certain
weight training. It's
diet,
like, it's
or
called,
reset their hormones, or cater to their gut microbiomes in a way. It's like it's all distraction. And I've this has become like viscerally clear to me the more I've dove into like women's issues, which are not necessarily my wheelhouse, of course, but it's very. It seems to me like it would be incredibly frustrating, if not altogether maddening, that like women are sold this lie, like that for some reason like calories are something that like shouldn't matter, or you know that you need a certain amount of protein that like men don't need. There's like no evidence for that. Like
there isn't, and if you look at the, you know, the way the ideal way to eat, by the way, is the way that is a sustainable, realistic way to eat in your life. Like, right? It depends on the person based on like who you are, what your preferences are, what your day looks like. But it hasn't really changed since the beginning of time. Like we need protein, fiber, healthy fats, carbohydrates. Processed food, not as good. Not eating enough, also not as good. Like sometimes you don't need a GLP-1, you just need to eat lunch. Sometimes you just need to like eat and listen to hunger cues instead of overriding them and having like a cup of coffee for lunch and then being hungry at night and eating whatever in sight. In other words, all of these diets like keto, Atkins, you know, whatever diet du jour that's out there are all just, you know, packaged. It's just packaging the same thing in a different color, a different, you know, marketing scheme. So the other thing is people ask me all the time, like, how much protein should I be eating? And I can give them like a number, but at the end of the day, like, I don't want you organizing your life around grams of protein. Like, you can do that if you want, right? But like, here's just the practical advice, because we cannot over-index on all the things. Like, have breakfast, have lunch, have dinner, ideally, and have protein with each of those things. Voila. And then you get to go and think about, did I move today? Did I get outside today? Did I connect with another human being today? Did I turn off my screens and like look outside and have some brain rest? Because if you try to over-index on like grams of protein and your weighted vest and your, you know, sleep hygiene and flossing after every meal, and oh, my dentist just told me, he asked me, are you timing yourself brushing your teeth for 2 minutes 3 times a day? And I was like, Dr. D, I'm not. Like, love ya, but like that's a risk I'm willing to tolerate because I just can't. I don't have time. Right? So you cannot over-index on all these things. Like optimization has a cost. So pick what you need, what you're trying to solve for, and then focus on that. But remember that health is about a whole lot of things at once.
Yeah, and what is it, the Pareto principle? Like 20% is going to give you 80% of the gains. Like prioritize the big levers.
Prioritize the levers and understand what your problem is first.
And also, and understand what those levers are, because that's where I think a lot of people get manipulated, right? It's like hyper fixating on minutia, because it's like it creates this drip of like the answers coming, but it never fully arrives, and that's what keeps you hooked on the, you know, the whether it's like the coaching or even like podcasts, like this like never ending cycle of like always one additional podcast. I mean, obviously we try not to lead audiences on in that way,
right?
But yeah, I think it's helpful to be clear about what those big levers are.
Yeah, and like you see a lot of people out there, especially, you know, healthy people who are looking to like prevent a disease, which I endorse. I have built a career around, in this mode of like searching, constantly searching.
It's the worried well.
Yeah, I'm loath to say it's the worried well, because the worried well also have like real problems, and sometimes actually the the searching for like the answer keeps them from looking at actually what's going on.
Yeah.
So like I have a patient he was a college athlete. He exercises like a maniac. He eats, excellent, healthy, nutritious food, and also has coronary artery disease. So plaque in the coronary arteries that's significant, but does not want to take a cholesterol medication. Even though it's abundantly clear from the vast amount of literature that we have on how to prevent heart attack, we have a specific target LDL goal of low density lipoprotein under 70 for people with coronary disease. He thinks he can exercise his way out of it, just tweak his diet a little bit more and bring that level down. So first of all, applaud the effort, but there are limitations to what lifestyle and optimization can do. At some point, there's biology and genetics and age that you can't change. So my job isn't to discourage him from exercising or eating healthy, but understand that like the marginal benefit of like adding 2 minutes to your run every day and like never having red meat instead of having it 3 times a year is minuscule compared to taking Crestor, rosuvastatin, 5 milligrams 3 times a week to help prevent plaque rupture and to get that LDL down. So know what the levers are, know what the data actually shows. And that's where you need a doctor.
Amen. Yeah. Well, thanks for doing what you do. Thanks for coming out. Thanks for writing this book. Thanks for being very refreshing, actually, to hear your perspective on this, which is quite refreshingly inclusive of, the wellness. I don't want to say the industry, because the industry is not indemnified from promoting incentives and from promoting a lot of BS, quite honestly, oftentimes. But I think there is still room in the conversation for self-empowerment through wellness-associated channels. I think that there's room for both.
Absolutely. When I was in medical school, I got sick. And I went to 3 or 4 or 5 different doctors. I got MRIs of my brain. I got told I had maybe had giardia. I was told XYZ, ABC. I was tested for all the sort of ancillary badness that you could have, and it was all normal. And I felt more crazy because no one could tell me what was wrong. And they're like, "Oh, you're fine. Your tests are normal." I had severe anxiety. I wasn't eating enough. My brain was not working. And it was only when I took myself, I just found someone in the phone book. I had not even really thought about therapy but I was like, there's something drawing me to ask myself some questions that the doctors aren't asking. And it was that when I realized okay, I have so much more power over my own health ecosystem than I even knew. You just have to listen for the cues, ask yourself the right questions, and then bring those questions to someone you trust to help solve the problem you actually have. I mean, health is not just about your lab tests. It's not about outsourcing your intuition. It's about mining your interiority, trying to merge your unconscious and conscious mind, taking some time to do that, finding a doctor who has time to help you understand you as a person, not just what your cholesterol looks like, and then solution together and accompany each other through the process of being human, because it's hard and it's hard to do alone.
Yeah, and it should be a collaboration. I had spine surgery about a year and a half ago at this point, and I understand that doctors are busy. Not every doctor is gonna be amenable to this, but my spine surgeon was texting me in the days, weeks after the surgery, making sure that I was okay, and any concern that I had leading up to the surgery, he was always there for me via text. I didn't have to go through some Byzantine bureaucratic office network. And I know that I was in a pretty privileged position. My doctor was not, it wasn't through insurance or anything like that. So definitely some privilege there, but yeah, I mean, find a doctor that is at least open to having your health be a collaborative project on which they can
partnership.
Work. Yeah, partnership.
And it shouldn't be a privilege to have a doctor pay attention to you. I mean, that's what's wrong with our system. We don't really have a healthcare system in this country. We have a health insurance system. So many of us have left the health insurance system, not because I don't believe in having health insurance. I have health insurance. But it's because the insurance puts particularly primary care doctors in this box where you really can't care for people the way you want. So, if I were to run the healthcare revolution in this country, it would be to have equitable access for all Americans to have primary care where someone knows who you are and not doesn't just look at your labs and say, you're fine, see you next year. And then people go on the internet.
Yeah.
In the middle.
Well, who knows what the future holds? Thanks for writing this book. Thanks for coming out.
Thanks for having me, Max. It's super fun.
Yeah, so fun. I've got one last question for you, but before we get to that, where can people pick up your book? And I know that you're pretty prolific on social media, or at least from what I've seen. Where can people connect with you on socials?
So I write a Substack called Are You Okay? And so you can find me on Substack. That's where that's where my people live. That's where my community is. It's so fun. I'm also on Instagram at Dr. Lucy McBride. I'm on that's my social handle for everything. The book comes out August 11th with Simon & Schuster. The book comes out in August with Simon & Schuster, and you can find it wherever you buy books. And you can also find it on my website, beyondtheprescriptionbook.com.
Love it. And forward by Mary Claire Haver. She's been on the podcast.
Has she?
She's a force. Yeah, she's great.
Mary Claire Haver is a force. She wrote my foreword. I just was on her podcast. She is a force.
She is.
She is empowering women one woman at a time.
We love it. We love it. We love our female listeners. Well, the last question that gets asked to everybody on the show, what does living a genius life mean to you?
I mean, it's so interesting, Max. I'm 53, and living a genius life means feeling like you're in partnership with friends, family, loved ones, taking time to like figure out what I need and advocate for it, and enjoying life and not thinking about life as a race. I mean, this whole book promotion thing is challenging that whole construct because a lot of it is like grindy. But if I've learned nothing else in my life, that health is about relationships, it's about quality of life, it's about being known, being loved, being understood. And that's what I look for in my everyday life.
Sounds about right to me. Thanks again.
Thanks, Max.
Thank you guys for listening. Share this episode with friends and loved ones that you think may benefit from it. And sending love. I'll catch you all on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.